Hello, everyone. Thank you for joining me. My name is Nguyen. I'm currently pursuing my Master of Health Administration. In this presentation, I'll be sharing a high-level financial overview of Unity Healthcare based on their 2017 annual report. We'll examine key financial indicators, analyze the short and long-term cost structures, evaluate the dynamics of supply and demand in the healthcare setting, and conclude with a proposed financial plan to support long-term sustainability. The goal of this presentation is not just to highlight the numbers, but to explore what they mean for real-world decision-making in nonprofit healthcare management. Welcome to this presentation on Unity Healthcare's financial position. In 2017, Unity reported total assets of approximately 99.6 millions and net assets of 55.4 millions. The total revenue exceeded 101 million, while expenses closely matched that, resulting in a modest net gain of $331,788,000. These figures suggest a well-managed organization operating on a tight margin, highlighting the importance of robust financial planning in community health setting. Unity Healthcare 2017. Unity's revenue is fairly diversified. Nearly half comes from patient services and the other half from grants and contracts. This balance is strategic, but it also signals risk exposure to public funding policies. Other income and donations supplement the budget, reinforcing the importance of community support and philanthropy. Unity Healthcare 2017. As with most healthcare institutions, personnel costs dominate the expense structure. Unity allocated 70% of its expenses to salaries and benefit. Additional costs include equipment, supplies, and operational needs. This structure underscored the labor-intensive nature of healthcare and the need of workforce sustainability. Gabensky and Pink 2015. Unity serves over 104,000 patients annually. A majority of the patient population lives below the federal poverty level, reflecting the organization's mission to serve the underserved. This demographic profile explains the emphasis on accessible, comprehensive, and culturally competent care. Unity Healthcare 2017. The payer mix is heavily skewed towards Medicaid and the uninsured, which presents financial challenges. Medicaid reimbursements are often lower than private insurance, and care for the uninsured must be subsidized by grants or donations. This reality necessitates continual advocacy for better reimbursement policy. Finkler et al. 2019. Unity operates within a broader healthcare finance ecosystem. Public funding, legislative decisions, and community partnership in all influence operational viability. Strong relationships with policymakers and funders are vital for ensuring continuity of services and advancing health equity. Flinker et al. 2019. In the short run, Unity's fixed costs like salaries, facilities, and utilities remain constant, even if patient volume fluctuates. Variable costs, such as supplies, are more flexible. Understanding this cost behavior is crucial for managing short-term financial health and maintaining service levels during economic shifts. Gapensky's and Pink 2015. Long-run costs include investments in technology and infrastructure. Over time, these help reduce per-unit service costs and improve efficiency. Unity's strategic investments in electronic health records and care coordination platforms demonstrate long-term thinking and pursuit of value-based care. Finkler et al., 2019. The supply of healthcare services is not limitless. Factors such as funding, workforce, and space determine how many patients Unity can serve. Enhancement in any of these inputs can expand capacity while deficits constrain it. This relationship is classically demonstrated using a supply curve framework. Gapensky and Pink, 2015. Here, we visualize Unity's supply curve. The upward slope reflects increasing marginal cost as output rises. A rightward shift indicates growth in capacity, perhaps through increased funding or hiring. Conversely, a leftward shift reflects a reduction in resources or operational strain. Finkler et al., 2019. Demand is rising due to high rates of chronic illness and social determinants such as homelessness and poverty. Unity's comprehensive approach addresses not only medical needs but also behavioral health and social support, positioning it to manage these demands effectively. Unity Healthcare, 2017. To ensure sustainability, Unity must refine its strategic goals. These include attracting more privately insured patients, expanding its donor base, and investing in preventive services. This approach aligns with health economics principles that prioritize cost effectiveness and community impact. Finkler et al., 2019. This slide outlines the proposed 3-year financial plan. Goals include diversifying revenue, reducing fixed costs, building financial reserves, and expanding programs that reduce unnecessary hospital visits. Each objective is grounded in measurable target and supports long-term viability. Flinker et al., 2019. Key recommendations include advocacy for higher Medicaid reimbursement rates, leveraging telehealth to control costs, and strengthening donor engagement. Collaborations with public and private partners will enhance financial resilience and service delivery. Gapensky and Pink, 2015. In conclusion, Unity is a cornerstone of healthcare access for vulnerable populations in DC. Its continued success depends on strategic financial management, advocacy, and a commitment to innovations. By aligning its mission with fiscal discipline, Unity is poised to thrive amid evolving healthcare landscape. Unity Healthcare, 2017. Before we close, I'd like to take a moment to acknowledge the sources that inform this presentation. The financial and operational data came directly from Unity Healthcare's 2017 annual report. To support the analysis and recommendations, I reference key academic texts by Finkler, Smith, Calabrese, Gabensky, and Pink, respected authority in healthcare finance and management. These sources ensure an evidence-based, graduate-level approach to understanding and addressing financial sustainability and nonprofit healthcare. Thank you all for watching. I hope this presentation gave you valuable insights into Unity Healthcare's financial strategies and mission impact. See you next time.